There we go. Good afternoon, everybody. Thank you for joining us for our first Showcode Spotlight of 2022. Before I pass over to our sponsors and hosts today, NHS Digital, just a very quick one on the VarsityCode challenge and on our Discord. So for those of you that have taken part and know, don't worry too much, but it is a very difficult challenge this week. So there's only, I think, just less than a week left to solve it. So I think we'll post links in the chat to Showcode so that you can sign up if you haven't already. You'll see the NHS Digital Challenge under VarsityCode. So make sure you compete in. We'll kind of look at the results in the end, and we will be giving away some swag for those that get 100% as well. So have a go at that. Make sure that you're registered, and yeah, we look forward to seeing how you do. If there are any questions about the challenge, or if there are any questions after this session, because I know there are people watching it retrospectively as well, you can post a message in our Discord server. We'll send links to that during the chat this session. We'll send links to that afterwards in emails and stuff as well. So again, if you don't have access to that, then you can join through our website. But that's enough about us. That's enough about me. I'll pass over to NHS Digital, who are going to take you through this session. If you have any questions, pop them in the chat. But yeah, take it away.
Hello there. So my name's Matt. I'm just going to be delivering part of this today with Hira. I'm just going to share my screen, pop a presentation on it so we can get started. So just bear with me 1 second. Let's hopefully I share the correct screen. That's the one I think I want. And there we go. Let's pop that into presentation view. Cool. So today, just very quickly then, so we're just going to go through some of the things that we're all about, NHS Digital. So our presentation is called Digital on the Frontline, Behind the Code. It's a bit of a snazzy title, and to go through like kind of just a bit of a brief overview of kind of what we're about. So just very quick introduction. So my name's Matt. I'm a senior systems engineer. I've been with NHS Digital for 5 years, working on various projects across the domain, and I'm really looking forward to talking to you today about what the kind of things what we do. And this is my colleague Hira. I'll let her introduce herself.
Hi everyone, I'm Hira. So I joined NHS Digital about 18 months ago on the graduate scheme. So far, I've been working on a whole different range of projects, some back-end projects, some front-end projects. And yeah, looking forward to sharing my experiences with you guys as well.
Brilliant. Thank you for that, Hira. So very quick question that I want to ask you guys. What do you know about NHS Digital? All right. So what do you know about us? What kind of things do you think we do? What kind of services do you think we have? You're more than welcome. Post thoughts in the chat. We have got a Jamboard, which I will post the link. I'll just stop sharing my screen 1 moment. I'll post the chat, post the actual Jamboard. In fact, Hira's done it for us. And we'll put that on the screen so we can share it.
Yeah, so feel free to come off mute and share your ideas, or if you just want to pop the sticky notes on as well, that's okay too.
So we added one as an example, the NHS app. That's one thing that we do. Can anybody think of anything else? Yep, COVID tracing. Anyone got any other ideas? I suppose we can start with that then. So with COVID tracing, there's several different parts of that. So there's the track and trace, where we're getting plenty of people where they get the figures uploaded for who's been in contact with one another. This is then shown in 2 ways. One, through the app. And also there's the tracing people, which get contacted with data sets and information. And they obviously then can ring people to let them know with what's been going on. Patient data, yep. So NHS Digital is responsible for all of that. So like maintaining and keeping hold of everyone's NHS records, which is something we're going to talk about later on. Prescriptions, yep, that's another thing that we do a lot of. Can we move some of these around? So, yeah, so we manage prescriptions, so people's prescriptions that they come and collect, or anything like repeat prescriptions, all of that comes through NHS Digital. When you get it, like from when you go to a GP and you get prescribed some medicine, and then you go along to the pharmacy to collect those things, that's all us communicating, sending that information across, and for them to be ready to be collected. Medical insights, yep, there's quite a lot of AI, there's lots of big data, a lot of machine learning going on, lots of different things that are happening in that space, trying to use it, and something that we're going to go through today about how it's used to like try and save people's lives, try and help people a lot. Obviously, there's the NHS app. That's one thing that was already on here. So that's where there's the application on your phone. Be able to log in. You can obviously download your COVID vaccine, your passport. You're able to view your data. You're able to very soon, I think, don't quote me on this, be able to change that yourself. So if you want to update where you live or your current address or your phone number or anything like that, that's other things that are coming along. QR codes when you enter venues. Yep. So again, that's I think more of towards the COVID pass, the COVID passport. That's something to be done that we're using. PDS. Yep. That's patient data. So it's actually called a PDS record. That's one of the things that's quite big. That's obviously used a lot, and we're going to be going through that in a bit more detail. Yep. 111. The NHS 111 service that helps like diagnose issues and anything else that's coming up, and like help you to like be able to diagnose anything yourself, or for it to give like information using algorithms. Let's have a look. Platform for national clinical audits. Yep. So being able to like audit data and audit clinical information. Choose and book. Not sure what's meant by that.
It might be like referrals, like choosing where you want to be referred, maybe.
Yeah.
Towards that.
Yeah, e-referrals, all of that is coming through NHS Digital. There's the booking service in terms of the COVID vaccine that obviously comes through. That's a site that's being built by one of the teams within NHSD. So basically, there's quite a lot. There's quite a lot of different services. I'm just going to pop the presentation back on my screen a moment, just then we can go through things. Honestly, we could talk all day. Just want to be able to show a few of the things that we've been doing. Let me do that. So again, here's just a couple of different things that we have gone through. Most of them we've already kind of talked about. So there's the NHS UK website. That's got a lot of the other services on there. It's where you can access NHS 111, lots of other different services. There's obviously the NHS apps. That's the thing you can get on your phone, get the COVID passport, be able to change all your details. Another thing that's maybe not so well known is the NHS Smart Cards. So when you go to your GP or where you go to hospital, everyone's got to be able to access this and like only access the services that they're allowed to see. So that's why everyone has got one of these NHS cards. I have one as well.
Not to interrupt full flow, Matt, but if you are trying to share a screen,
I'm not sharing my screen. Right, sorry, my bad.
There you go.
I forgot about clicking that button.
No worries. There we go.
There we go. Sorry about that, guys. So yeah, so the NHS Smart Card. So that's what I've got a picture of there. So yeah, everyone has got them within NHS, the actual wider NHS. So if you go to an NHS trust or if you go to the hospital, they'll be accessing the systems via one of these, and it only grants access to people what they're allowed to see. So another quick question that I'd just like to ask. Why is this stop working? Right, my screen is no longer working at all. Can I do that and pop it back, open it? Sorry about this. For some reason it stopped working on my screen. Right, there we go. Sorry about that. So one of the services that we've got, one of the main services is called Spine. Does anybody, just quickly in the chat, does anyone have any idea why do we think that it's called Spine? Why do you think that we decided to call it that name? Any ideas? Let's give another 10 or 15 seconds.
Take a guess if you're not sure.
Yeah, any guess? I'm open for anything. Okay, I'll tell everyone. So the reason why we call it the NHS, why it's called Spine.
Someone kind of got it. Someone kind of got it.
Oh, there we go. Yep, it's the backbone of the NHS. So the idea is it runs down, all the different services are using it. It's just like the actual spine directly down the NHS that everyone needs to use. So I have got a quick video. I am going to have to stop this again because that's the way it needs to be done. And I'm just going to put myself on mute and I'll show the little video.
This is the NHS Spine. Every second of every day, the NHS Spine saves lives. NHS Spine transports 3,500 electronic messages per second between 28,000 NHS IT systems across 21,000 care organisations. That's up to 47 million messages every day. It provides secure access to over 65 million summary care records, over 90 million demographic records, and securely sends 750,000 e-referral messages per day, 2 million electronic prescriptions per day, to help the NHS care for thousands of patients. NHS Spine's applications are used by 500,000 NHS health professionals a day, and counting. This means doctors can decide quickly on tailored life-saving treatment, GPs swiftly refer patients for urgent hospital diagnosis, paramedics reach the people in most need of their help, pharmacists check prescriptions are correct for vulnerable citizens. Lives protected, changed, saved, every second. This is the NHS Spine.
Okay, cool. So I'll just make sure I'm sharing my screen again. I think I'm gonna have to knock this off compared to last time. So just very quickly then, so a couple of figures that we have got that are more up to, I stopped doing it again, just bear with me. Don't want that. So just spine, just quickly in numbers then. So yeah, as you can see during that video, we shared several different facts. Some of those are even now out of date because they constantly change. One of them being how many actual messages that are sent every day. It's now up to about 61 million per day, which is about just over 1.8 billion transactions and communications that happen per month. To put that into context, debit card transactions last month was 1.9 billion. So it's very comparative that the amount of times that this is used is the same as debit cards across the entire UK. So it's used quite a lot. And again, lines of code that we've got, there's over 300,000 lines of code. I think it's about 305, somewhere around there. The number of unique users that we've got is over 170,000. Obviously, that's unique users. Multiple users have got access to multiple different systems. And we actually have 100% uptime and availability. So it's really key systems that are used. Like this one, for example, Spine, it's all about your PDS record. It's all about you accessing or healthcare professionals accessing your records and sending messages to one another. Everything like that has to be done securely, and it's done via Spine. So it's such a big system. It's really good. It's a really good feeling to then give back a bit as well with the kind of projects that we work on. So I am going to pass it over to Hira now for Hira to carry on. I will. Do you want me to continue the presentation, and then I'll let you just tell me when to move on.
Yeah, that's fine. Yeah, so as like Max explained, like one of the main goals of NHS Digital is to deliver services which will like support clinicians and patient-facing colleagues all across the NHS. So we just wanted to kind of ask you and let you have a think about from what you already know about the NHS and what you might have gathered from the news, or just like general knowledge about your own experiences of the NHS. What do you think some of the main challenges are that the NHS faces now and will face in the future? Again, like if you just want to add some ideas into the chat, or if you want to come off mute and share your thoughts, that would be really good. Just give people a couple of minutes to share some of the ideas. Yeah, don't feel too shy.
Yes, well, don't be worried. Anything. There's lots of different things. There's no right or wrong answers.
We've got some going in now. So yeah, one really good one from Sammy is legacy systems. That is definitely one of the challenges that we deal with like day to day across NHS Digital, is like uplifting systems. And we'll be talking through an example in just a bit. An aging population and funding, yeah, definitely a big issue in the NHS. You've definitely probably heard about that. Capacity versus demand with staffing issues. Yeah, huge demand for their services. We've got two about security and protecting its data. Yeah, like NHS Digital does take the responsibility of protecting patients' data very, very seriously. And obviously that increases as you gather more data with more people. Funding as well. Yeah, that is a big part of what we do at NHS Digital, is to make sure that we can deliver services using resources effectively, making sure that we're not wasting, obviously, public money when delivering services, and make sure they're as efficient as possible. Another big one here is society is changing to everything being instant and digital, so the NHS needs to keep up with this. That is definitely a really, really good point. So I think some of those services that we talked about right at the beginning, like NHS App, 111 online, all those like services that allow patients to kind of take control of their own data and their own healthcare as quickly as they need access to it, definitely feeds into that. And yeah, I'll round this off with Mary's last comment, which is a good one. Sharing data across not just NHS services, but social services too. Like, yes, that is a big theme across NHS Digital, is like integrating with social care. So yeah, those are some really good ideas that it shows that, like, you know, people are definitely aware of the different challenges that NHS faces, and those are the challenges that us at NHS Digital, we are here to help support our colleagues across the NHS with as well. So we've just got two kind of examples of NHS Digital services that are helping kind of frontline NHS staff. So one is this improving cardiac arrest outcomes. So as you might know, is that like cardiac arrest, when someone is having a cardiac arrest, they do require rapid diagnosis and treatment. And so one of the services or software that supports healthcare workers with this is the NHS Pathways clinical decision support system. So it's a triaging software that is provided by NHS Digital, and it's used by all 111 services and half of the 999 services in England. So this software is a series of algorithms or pathways that link clinical questions to care advice. So when call handlers in 111 or 999 receive a call, they can guide the patient through a series of questions, which will feed through a series of algorithms and will help the call handler get to the right response to ensure that the patient gets the correct care that they need. So a pretty incredible statistic that we found out was that over the past year, NHS Pathways identified nearly 20,000 suspected cardiac arrest patients. So that means that's 20,000 people that were able to receive a quick ambulance response. So hopefully that kind of puts into perspective, like, day-to-day software that you might be working on can actually have like a real life and death impact on people. And another example that we've got on the next slide is someone mentioned about dealing with legacy systems, and this kind of stream of work feeds into that. So a big part of NHS Digital work is to help make our websites more accessible. So the Summary Care Record website allows healthcare staff to view an overview of patients' information and help them to make decisions about their care. So on the left, you'll see we've kind of got like the old style of website, which is more suited towards being seen on like a computer browser. You can see like the UI is not quite as modern as we might expect in these days. And so visually, it's not that easy to read or follow. So some of the work that our teams have been working on is to redesign the website to the one on the right. So as you can see here, the redesign has meant that it's a lot more accessible for people. So users with different needs should now be able to navigate this website a lot easier. And it should be able to be more compatible with newer devices such as iPads. So a really good example of where this is being used like in real life is the London Ambulance Service. Because they're able to load this Summary Care Record on their iPads, they can get patients' information on the move rather than waiting till they're in like a hospital or a clinical care setting. So as you can see, like being able to kind of keep up with newer technologies can really like save time for people's everyday interactions with the NHS. And yeah, so those are just a couple of examples that we wanted to talk through to kind of like show the impact and the breadth of the work that NHS Digital do. But now I'm just going to kind of move on to a day in the life of me as a developer. So I hope this like part of the session just kind of gives you an idea of what it is like to work day to day as a graduate developer in NHS. So currently I've been working in the spine team, and that was where my last placement was. So this is kind of like a typical day that I might have gone through. So yeah, I've started off my typical day here with some personal development and training. So yeah, learning and development is like a really, really big part of the job, and it's a big part of the culture at NHS Digital. It's something that's not just you as a graduate, it's something that's made time for people all across the company. So in this time, I might use it to work towards a long-term development goal, such as pursuing like a certification, for example, for AWS or something, or I might be using it for a more short-term goal. So for example, in my last project, I was doing front-end work using React tech stack, which was quite new to me. So I might have used this like personal development time to kind of brush up on my like React skills and JavaScript skills. So I feel like more confident as I'm working on my new placement. Next, I've got our team stand-up. So yeah, when you're based in a team, you usually have like regular check-ins with your team. Here we have like a 15-minute check-in every morning just to check on each other's progress, pick up tasks for the day, and I can raise any problems that I'm facing. And you'll find that this is really common across NHS Digital as we follow agile practices. So stand-ups are a big part of our day. And then next on my list, I've got like starting to work on my ticket. So on the next slide, I've got like an example ticket that I might be working on. So I've got here like a ticket that's looking at web accessibility on our front-end website. So some of the steps that I might follow when starting work on a new ticket is to kind of create a branch, feature branch for me to start working on, looking through the latest code, the latest changes in the code, seeing what's changed since I've last looked at it, trying to get my head around the area that I'm working on. Across NHS Digital, we follow like test-driven development. So with this practice, we try to write our tests and our use cases first before jumping in and writing the code. It's something that you'll have a lot of help with getting to grips with if you haven't done it before. But it's a really, really great like development practice to follow, as it means that you can be really confident in the code that you're writing will actually follow the function that it needs to do. So like next on my list, I've got like just looking at making a plan and researching. So again, like if it's like a new tech stack, I might be like looking around with different resources to follow best practice. And then I might actually start writing some code and maybe doing some manual tests afterwards just to check it out. But yeah, for something like this ticket, I might not have previously had a lot of experience with accessibility and web development. So picking up a ticket like this would be like a really good opportunity for me to stretch my skills and try and build new knowledge. So hopefully I think that highlights some of the trust that the team will give you to work on things that you haven't done before, and the opportunity that you have to learn on the job, as well as in your kind of like structured personal development time. So yeah, moving on to the rest of the day. I didn't hear like the platforms coding group. I wanted to kind of give an example of some of the more social and networks that we have at NHS Digital. So the coding group is like where developers can come together every fortnight, where we can lead sessions on useful topics. So for example, somebody might have learned something new, or maybe want to share some experience in maybe like regular expressions. So they might want to lead a session on how to work with regular expressions, so we can all learn about that. Also, we might just do some like fun coding challenges. Some of the ones you might have seen yourself, like Advent of Code. So it's really just a good idea to like practice our skills and share knowledge at one of these like short sessions. Next, got the most important part of the day, lunch. So I kind of added this in, is that days at NHS Digital are quite flexible. You can like take your break whenever you need to, as long as you make up your hours. And for me anyway, I've really benefited from this flexibility, especially when we've had to work from home. Like I don't feel too rushed when I'm taking my lunch break, and it's really good for your well-being to not feel that kind of pressure. So yeah, it's a really good working environment there. And yeah, next on my afternoon, I've got a show and tell. So yeah, as I've mentioned so far, there's a real emphasis on learning and sharing knowledge across NHS Digital, and show and tells are just another part of that. So developers from across the team might use the show and tell to share new features that they've developed. So you get to kind of see new products that are coming across NHS Digital, and you get to learn new practices from them. It's also a really good way for you to share new features that you've developed as well, so it can help reinforce your own learning, and you can also get feedback as well from other senior members of the team. It's just part of the learning kind of culture we have here. Next, I've got paired programming. So I might decide to like pair with another senior developer on my team while I'm working on my ticket. And pairing together on a ticket is a really, really good practice that a lot of teams will encourage, because it means that if you're stuck, you can get a different perspective on the problem that you're facing. Or if you're pairing with another developer on an area that you've not had much exposure on, you can learn from them about how to do something. So, for example, I may not have had much experience when I started out with AWS, but other developers on my team may have. So I might choose to like pair with them to learn more about it before tackling a ticket by myself. So yeah, it's just kind of showing that like the team is very, very supportive about each other's learning. And then yeah, towards the end of the day, I've got a user research session. So as I mentioned, like my current project was a web development project, and it was a website to help users to register with a GP online. So our user research sessions, we held them with citizens who might be looking to use such a website to register their new GP. We also held them with GPs themselves to see like, is this a solution that you would find useful? For this current project, it was just really, really powerful to hear from GP reception staff some of the difficulties that they face day to day dealing with the administration of a paper-based form, and hearing from them like the impacts that having a digital-based service would have on their day-to-day work, and how it would reduce a lot of the administrative burden for them is really, really powerful, and it shows the impact that your day-to-day work has on other people. So yeah, if you do get the chance to attend user research sessions during your time, I would definitely recommend them. They're really, really useful. And yeah, today, here I've got like finishing off my day with a code review. So this could be me like reviewing someone else's code, or it could be somebody giving feedback on mine. And again, this is just like another example of how the team supports each other learning, and it kind of shows that how we all try to ensure that we deliver work to a really high standard at NHS Digital. And yeah, that's kind of me wrapping up my day there. And I think we've like reached the end of our session there. So does anyone like have any questions that they want to?
Thank you both very much. I think there are maybe a couple in. I think get them in on the chat as well if you do have questions. A quick note before we get into these questions. Mentioned it a bit at the start, but obviously if you're watching retrospectively, you can get them in for the team at Discord and we'll send them over to you. we'll send them over to the team at NHS Digital to get them answered. So feel free to ask them if you're watching on YouTube as well. I think to kick things off, while people kind of process all of those numbers and the day in the life here, I think, kind of get any questions in about anything you've seen in this session. But for me, one of the interesting things, and just looking at one of the comments in the chat from Jason around the kind of personal development time, I guess the first question would be, is that, something that happens across all streams? You mentioned you were working on spine, for example. So, is that something that graduate developers get no matter the project they're working on at NHS Digital? And then kind of building on that, I guess, is it always at a set time, or is it sort of flexible to you and you just get kind of like a set allocated time or whatever it may be?
Do you want to go? Do you want me to go?
I'll just go. So the 9 to 10 is just like my choice. So that's like in my example day, I might choose to use that hour in the morning. It's quiet hour in the morning to do my own kind of learning. But it's definitely not a fixed time. Like, it's not like you have to pick a specific time and you stick to that. It's definitely flexible to you. There might be some times where I might just block out like a full day to just sit through like a very long like training course or something. It might be like other times I might just do a little bit every day. It's very, very flexible. It really depends on what you're learning and how you learn best as well, I think.
Yeah, I think that's the best thing to reinforce, that it's kind of based on you, like, especially as any level within NHS Digital and whatever career path you choose. It's very much a case of it's down to that individual, and it's very flexible. Well, the individual and your manager, and like, I've not heard of any case where there's anything's been refused or anything like that, and it's always a case of it's flexible for you. So if you work best like coding at between 9 and 10, then that's great. If you then want to learn like maybe 3 until 5 or 3 until 4 in the afternoon, something like that, then that's great. Then that as long as it works for you and it's working for what the team are going through at that time, then we're more than happy and more than flexible with anything like that. And to do with courses, you can get lots of different courses. Like recently, we've had lots of people going on AWS courses, for example. We're really big on cloud computing at the moment, AWS and Azure. So there's been lots of training courses for people to go on that are official AWS run led training courses, but not just limited to that. We have like Pluralsight, O'Reilly subscriptions as well that is open to anybody if they require them. So yeah, it's kind of flexible based on what the kind of learning that you guys want to do, really, or the individual. Let's have a look. What other questions have we got on there? User research, you actually go to the field. In terms of the user research question, I think it depends. It really does depend on the team that you're in and depending on like what discipline you're in. So in terms of developers, I think it's a bit of both. Like, I know a couple of people that have been to Leeds Teaching Hospital because that's where one of the headquarters for NHS Digital is in Leeds. I know a few people that have been up there and actually had people communicating to clinicians and to actual staff, both in terms of user researchers and in terms of developers as well. So you can get that full-on like experience, and that you're learning properly from the people that are asking those questions and the people that you're directly trying to help, which is really key for any sort of development or anything like that. So I think that it really does depend on which team you win, what the kind of work that you're kind of working on at the time, where it is. I know people that have had meetings with like the London Ambulance Service, like to get that direct feedback and be involved in those conversations. And again, like what Hira said, like, it's encouraged, especially for graduates and people like people at the beginning and at the end of the careers, or in the middle, to actually get involved in those, so they can have a real impact on the kind of support and the kind of like technology and things that we're producing. Let's have a look. Do you sponsor work visas? It's not. I think it depends on the person and depends on the circumstances. I know that it has been supported in the past. What it would be at the moment, I couldn't tell you. I don't work in HR, but I think it depends on the individual. So I think I do know a few people that have gone through it, but again, it all just depend. Position on overtime, I think again that depends on the project. It can be. It depends on the project and depending on the circumstances and what's going on. And it's to do with flexible working as well, because we are quite flexible. Like if people wanted to work from 7 in the morning until 3, that's generally fine. If people wanted to work till 10 till 6, that's also fine. And in terms of overtime, it depends on the project that you're working on. If there's a lot of need for that, if there's pressing needs, like say, for example, COVID, that if people want to work overtime for that, then that's allowed. But it's not like expected, and it's not frowned upon if that's not something you want to get involved with. It's one of those that it's open if needed and if you're wanting to do that, but it does depend just on the project that you're working on at that time. Let's have a look. Positions advertised are remote, but not very clear on expectations on attendance in the office. Do you know what expectation for office requirements there are for the dev jobs currently advertised? That's a really good question. I think at the moment, the way I would think of it is that it is all remote currently. But with the offices being open, whether that's, I think it's primarily across 3 sites, which is Leeds, Exeter, and there's an office in London, but there are other offices as well, and not just limited to those 3. I've not had, in the last 2 years since COVID, I think I've been into the office 3 or 4 times. And that was my choice. That wasn't saying you must be in the office. I think ultimately it will be a level of hybrid working, but what that landscape is, I don't know, and it's not something I could comment, because I don't comment on too much, because that's down to more of HR. But I think, again, because we're quite flexible and how that works, I think it would come down to the individual and the team and all that sort of thing. I think that's kind of where a lot of organisations are going. Some are going fully remote, some are going hybrid. I think we're kind of in between in what we're kind of like trying to deliver at the moment and the expectation going forward.
I say, like, so far during like pandemic, as like the different restrictions have changed, it's always been very flexible to the person as well. So you've always been able to give your opinion on how you feel as it's changed as well.
So Amy, you've said about, can you talk a bit about the summer internship and what programming languages you mainly use? Yes and no, or yes and not so easy question, because we work on such a breadth of services and teams and disciplines. Saying one specific programming language we use, I wouldn't say there is one. There's flavors in pretty much anything you can think of. There's Java projects, there's Python, there's .NET, there's stuff where it's on-premise, where it's still live servers and servers. There's also AWS and Azure. Like I said, a lot of it we're trying to move towards the cloud. And that's where a lot of our work is at the minute. But then there's also lots of other disciplines. There's a team that's all about data, where they use a lot of Apache software for doing data analysis. So there's multiple different things and multiple different languages that we also use. It's not just programming languages as well. So like lots of other flavors. So there's lots of front end work. Excuse me. So there's like, we use a lot of React for front end. There's Angular, and lots of other languages for lots of other front end technologies are used. There's lots of back end stuff. like infrastructural sort of languages, like Puppet, Terraform. I could go on, and I think it's kind of one of those things where what you normally do is for a summer internship, it's normally about 8 to 10 weeks long. You normally work on a specific project where it's like a short-term project where you have an end goal. I believe, like, Hira, you probably know a bit more about this than I do. There was recently a summer internship within your team.
Yeah, definitely. So like the way we kind of like set up the project to make sure that they could get the most out of like the 10 weeks or so is like we can kind of look at like the experience that they've already got. So if they already know some programming languages, and obviously like we might try to like shift the project so it makes use of those. And also as well, like, yeah, because like when you come on the summer internship, they will be aware that like it is a short amount of time. So they won't be like asking you to like pick up something like huge from scratch and expect you to deliver it in 10 weeks. That's not realistic. So I wouldn't like worry too much about like the specific programming language. The project will always be kind of designed with your current experience in mind, and with the mind, it will take into account how much like learning you can do in 10 weeks. So yeah, the summer interns that we worked with, we like made sure that they had some experience in the language we were expecting them to use, and gave them like enough time and resources so they could like advance their skills kind of quite quickly within like the first 2 weeks, and then they got really kind of stuck in after that.
Cool, thank you for that. So Sue Lee has said, how's the NHS Assessment Centre experience like? Well, do you want to give your experience first, here, because obviously you've probably got a bit more experience from that side there than I have?
Yeah, sure. I'd say it's definitely not as daunting as you may think it is. I was definitely very, very nervous when I first thought about it. But when you come into it, it's definitely not. For the one that I went to, there was like a mix of kind of looking at personal development and competency type of tasks. And then also like some technical tasks as well. So yeah, for the technical tasks, it's kind of like for me anyway, it was like a whiteboard challenge of kind of like a small coding challenge, but explaining it out on a whiteboard. Again, from my experience from that was, again, it wasn't so much about the specific programming language, it's more about your logic and how you talk through a problem. And again, for like the competency type of things, it's, you know, things like how do you work together with other people in the team, how do you solve problems together, those kind of exercises.
Yeah, and then from my experience, I've been an assessor for the last few years at the assessment centres. Like recently, obviously we've obviously moved all online. It's very much a case of, I think you've got to solve a problem, try and put things in order in terms of how you would solve that. Not just programmatically, I mean in terms of like, oh, this has come in, how would you respond to it, what order? A few things like sent in, like saying, oh, you should notify celebrities and things like that, just to make it a bit more interesting, a bit more exciting. And then there's you get asked a few questions by someone like on a panel. And it'll be just general questions, nothing too deep, or going into like, or how would you code this problem in terms of what's this programming language and what is it doing? They're very generic. We're more of after that relationship, like trying to communicate, just so we know that like the person fits us as well as the other way around. And so yeah, so it's not really a daunting thing. There are a few competency things, like say, your typical research, like what are some of the values of NHS Digital, or what do you think of this? So it's that kind of experience. It's not like really heavy into like technical detail or technical questions. It's more of thinking about it from a general sort of point of view. That's kind of the general feel that it's got, and it's supposed to be a good experience for everybody, and not too scary thing. It's only across one day as well, which helps. Do you open up some of the research sessions for suppliers? It would be great to attend some sessions around the issues/challenges. I'm not too sure about this, to be honest. I think there are a lot of, I think we do have like workshop sessions where we will talk about and like do presentations about what we're doing or what's the latest things that are coming up. I don't know if there has been any recently, if I'm being totally honest, but it's something that I could always go away and find out and let Alex know about if there have been any sessions or if there are any coming up. In terms of actual suppliers, like we obviously connect to. It's not just directly to like NHS trusts that we connect to. We do connect to other suppliers. We do have like sessions with them and to go through certain things and to ask for their feedback as well. Whether that's open or not, I'm not entirely sure, but it's something that we do actively engage with and try and get people's opinions on. I think we do user research sessions with some general public, but again, I think that it depends on the team that you're working on, where that has those communications. I think that's that one. It's not interesting. It's interesting to hear about teams following the test-driven design process, as it's often believed to be better than writing code before tests. Yep, it's very true. Do you find that doing this works in practice, or do developers often actually dive into coding before writing tests? Good question. A bit of both, if I'm being honest. We do actively promote it. I know on Spine there's certain areas where you really try to do that sort of test-driven development, because otherwise it can be quite difficult to understand what is going on, and it really helps you because it makes you think about what you've got to include, what the features are, and you refactor in your work as well. And it works across multiple other projects as well. And yes, but some people do try and jump in and try and just like start coding, but it's not something we actively say, oh, that's the way you should do it. But again, everyone works in different ways. For me, we try and push it, especially if we're doing paired working, we try and follow that sort of approach. So we can show that, and we're keeping up with good practices with following TDD. So that's that question. How often are the NHS, when it comes to trialing new technologies, on employees' recommendations for ongoing projects or even in unique projects? All the time is my simple answer to that. It's not something like because I think it shows in the way that we do use a lot of technologies, the way we try and think about things and put things in terms of creating new software and new technology, is everyone is open to listening to the ideas and actually go through with them as well. So for example, if you are working on a piece of technology and you're working in a team and you were to promote something that they thought was a good idea, there's plenty of opportunity to then like do scoping work and to find out, see if that would help and would improve any practices. There's also a lot of like the older technologies that we're now uplifting. We do like different proof of concepts where it's tried in different things. I know one in Spine's been done across a multitude of different cloud technologies to find which one's best for us. And like you get the opportunity to actually do that investigation work. And it's not something that's then, if you've not found something that works, that you then shut down every time. It's just a case of, right, we've used that one, how about this now? And there's always plenty of chances to then introduce new technology, and it's the way we like to go about things, as long as it will then add, and we can prove that it's going to add to the project that we're working on. Where am I up to? Would NHS collaborate with health tech industry, maybe specialized app for, say, Apple Watch or wearable health trackers? Yeah, no, that's a really good idea. I don't know about the health trackers bit. I think that's something that we'd probably like to get into that space. I know we're opening up a lot more technologies at the moment. There is a specific section on NHS UK website that is for more developers wanting to access things via specific like open APIs. And I think that's somewhere where we could go down, but that's not currently within our thinking. But it's something I think there's probably going to be a pressing need as we go forward. In terms of collaborating with health tech industries, I know we do communicate with quite a few different health industries. Again, it's not really my area of where I've developed at the moment or where I've spent much time with, but I know that there is active communications going on across the NHS estate as well as within NHS Digital. Is the internship paid? I believe so. I couldn't tell you specifically, but I believe it is paid. But it's something that would have to let you know about for me to confirm whether it is or not. Thank
you. The opportunities, those have been posted in the chat as well. Just for the couple of people asking, but obviously you can take a look at what the course says.
Cool, thank you. So I presume that will be the internships as well. Where can you find available Yep, okay. So yeah, I think that's all questions that have been asked. Has anyone got any other questions?
There's a couple in the Q&A section. So one about how many projects are you allowed to be involved in simultaneously, or how many projects are you involved in simultaneously?
Again, it really depends on the person and the team that you're in. Each teams generally are assigned, or not necessarily assigned, but have got certain systems that they're responsible for. For example, the team that I'm in, I think we're responsible for about 4 or 5 different subsystems. So obviously that's given that breadth of 4 or 5 different systems. But then there's also the scope of within the spine space for me and other developers to move around. So you get that different experience, you get that exposure, you're allowed to work on different technologies. Here, I think you're best to come at that from a graduate perspective.
Yeah, so I think on something like spine, where there's kind of a whole series of linked services, you might find yourself picking up tickets from different areas potentially. So far on my placements, I have mainly just tended to stay within one project or one area to kind of get an in-depth kind of understanding of that area, because often they are quite kind of broad anyway. But again, I definitely think it's up to the person and how you feel as well. I'm sure there's you could speak to line managers to get more experience or exposure in other areas if you wanted to. But yes, working in something like spine, you just naturally will probably get an eye for different projects while you're there, just because of the size of it.
So yeah, I think just to come back round on that, I think it does depend on the team and depends on what you're working on. But there is obviously a lot of scope for things. In terms of the other question, how many years of experience are required for your Band 8C content designers and UX researcher roles? I think that just depends on the person. Again, I'm in the developer profession. I know how many years it would be expected in terms of developers, and for senior developers, and going up the bands in terms of content designers and UX researchers. I think it would just depend on what relevant experience and what that team are looking for at that time. So I think it just depends on the person really, and what they've currently got. My gut feeling is it would be at least a few years because it's an 8C positions. But again, I wouldn't like to comment on what they'd be specifically looking for.
Cool. Thank you very much. I think 2 things. I think that's probably the most questions we've ever had on one of these sessions. So I think you can take that as a good sign, and well done for getting through them all so successfully. So thank you both very much for your time. Thank you everyone for attending as well. It's been really good. And like I say, if you're watching this kind of retrospectively, and I mean, there's a slide with contact details and stuff to tie off. But yeah, thanks for getting involved with the questions and everything. So I'll pass back over to you, Matt, to do a little outro. But yeah, just a big thank you to everyone. And remember to get involved in NHS Digital's VarsityCode competition if you haven't already.
Yeah, thank you. I just want to say thank you for that, and thank you for all the questions. It means a lot that you've obviously got a lot of things that you'd like to ask us. And yeah, hope to hear from some of you soon, and maybe see some of you in assessment centres in the not too distant future.
Sounds good. Yeah, big thank you to everyone. Everyone who came, and yeah, as I say, just don't be afraid to get questions in afterwards, and we'll pass them on to Matt and Hira. So yeah, thank you everybody for attending. See you later.
Cheers. Thank you.
Bye.